There's an interesting question that came in. A 40-year-old patient had a diagnosis of a chondrosarcoma and 4 years later an epithelioid sarcoma, and asked, does genetic testing help for this follow-up and management? So what I would say is, when you see somebody who has multiple sarcomas, or more than one cancer for that matter, who's relatively young, it makes you think, is there something in their body, in their, what we call the germline, all of the genes that they were born with, that might make them more likely to have a cancer or sarcoma. And so this is the type of person that if I were seeing, I would refer them to our genetics program. Our genetic counselors go through a patient's family history, a patient's individual history, and then talk with each patient about, are there particular syndromes or genetic alterations that the patient may have inherited or been born with that might increase their risk for having cancers or multiple cancers. And then there is testing that can be done, and then reviewing what the testing can tell you about that risk or not, and then making a decision together about whether or not the patient wants to go through with testing. And following testing, and I think this is where going and speaking with genetic counselors in a real genetics program is helpful, is when the test results come back, what does that mean? What are the implications for the patient who is sitting in front of the counselor, as well as for the patient's family members who may also, because of being part of the family, also be at risk if a change was found or something that increases their risk for cancer. So a very good question, and certainly there are some familial genetic disorders, things that you can inherit that can increase your risk for developing sarcomas.